Hi, my name is Kasha Bees, and today I'll be doing a central line dressing change. I be scanning the room. I'm just going to give a disclaimer that I will be touching my computer to wake it up on my new desk to break instability. So the first thing I'm going to start with is I'm going to verify the order and verify the hospital policy. After I verify the order and verify the hospital policy, I'll perform hand hygiene. After I perform hand hygiene, I will do 2 patient identifiers. So I have Jaguar Jones, date of birth 08/25/1963, 08/25/1963, MR number 417-652, 417-652. In addition to doing 2 patient identifiers, I will assess for allergies on the patient or amend the patient's allergic to penicillin, and also on the patient's order from the patient's allergic to penicillin. So after I've done that, I would explain the procedure to the patient and gather my equipment, and then I would provide privacy. So after I've done that, I would assess the patient and I would gently palpate over the area. And after I palpated, I would perform hand hygiene. Then I would get I would have my central line dressing on the bedside table, and that would be at a working height, above waist level, but I don't have anything that is above waist level. So after I've done that, I would then I would raise the patient's bed to a working height. I would raise the bed to working height, lower the side rails, and I would have their head slightly elevated. Then I would open my kit. I'm not going to discard my kit. I'm just going to place it to the side because I'll be reusing it. I will do the flap first, then get my mask on. Put my mask down so you can hear me. Then I'll put on my goggles, put on my clean gloves, and I will also assist my patient when putting on his or her mask. So after I got my clean gloves on, I would be removing the old dressing towards the center. And this is someone's skin, so I do know I would pull off very gently to not hurt the patient. So now that I got it pulled off, remove my clean gloves, glove to glove, skin to skin, into the trash can. So after I've done that, I would assess the patient for any arrhythmia, redness, any type of drainage, or anything that I saw that was abnormal. And if it was something that was abnormal, I would get me a culture swab that's in the kit, and I would just swipe, and I would take a sample of it, stick it into the sample container, and send it off to the lab for further testing. Then now I'm going to finish opening my kit, going from side to side, and then closest to me. And then I'm going to get my sterile gloves. Then I've done my sterile gloves. I would then get my alcohol swab to clean. I will be going in horizontal, vertical, in circular motion, and going in rainbow fashion, and while twisting my cotton swab and not going over the same part twice. then I'm going to discard that. I'm going to take my chlorhexidine. Then I would activate it by clicking it, and then I would be cleaning. I would just hold this to clean vigorously. I do know this hand is contaminated now that I've touched this, so. Discard. Then I'm going to take my bio patch. Take my bio patch. Have the blue side facing up. Have the blue side facing up. And you would put it on according to hospital policy. Then I would take my Tegaderm. I would remove. And I would place it over the insertion site. So, then I will remove the outer portion. Then I would take my label. I've already pre-labeled with the name, the date, and the signature, and I would put it on the side, not putting it over the insertion side, just put it on the side. Then I would remove my gloves, my mask, and I will also remove the patient's mask. I would perform hand hygiene. Then I would put the bed to the lowest position, raise the side rails. Then I would document the side of the appearance, if there is any inflammation, infection, how the patient reacted, if there was a culture used or not, and things of that nature. And this completes my central line dressing.